Hello everyone, my name is Christiana Hiola. Welcome to Doctor's Perspective on Maxi Health. Today I'll be talking about a condition whereby that is preventable and is treatable. And that condition is a cancer, is a type of cancer that is treatable successfully if diagnosed at early stage, and it can also be prevented. But I'm surprised that despite the fact that this condition is preventable and can be successfully treated if diagnosed earlier, so many women are dying from this condition. And that is one of the reasons why we are talking about this topic on this segment today. Cervical cancer is a type of cancer that affects the cervix of the woman, and the cervix is the region between the vagina and the upper part of the reproductive part of the woman. So once there is cancerous cells, that is abnormal growth in this region of the body, that is what we call cervical cancer. And in 99% of cases, this cervical cancer is associated with a virus called human papillomavirus. Human papillomavirus is a sexually transmitted virus and can be treated. But once exposed to this virus, frequent exposure to this virus increases the risk of having cervical cancer. So why did I say this condition can be treated and is preventable? One, there is vaccine for human papillomavirus, that's this HPV. There is a vaccine for it. So once people have vaccinated, the risk of having this cancer reduces. And also, if someone goes for screening regularly, this screening is going to identify precancerous cells. That means before that region becomes cancerous, they identify these cells, and intervention is being made to prevent this disease. So, what are those symptoms that we need to know? Cervical cancer does not show symptoms at early stage, and that is one of the reasons why we need to go for screening. So, what are those symptoms? One, there is vaginal bleeding. The vaginal bleeding can be in between sexual intercourse. It can be an abnormal bleeding from the private part. It can also be foul-smelling vaginal discharge, and there can also be pain in the lower region. Once you notice all these symptoms, don't wait, don't sleep on it. Make sure you see your physician. There are some people, yes, that you've started. You are more than 15 years old. You want to ask if you can also get vaccinated. Yes, you can get vaccinated, but you need to consult your physician to know when and how you can get vaccinated. What are those symptoms? What are those things that increases the risk of having cervical cancer? Number one is one having multiple sexual partner. Having multiple sexual partner, having starting sex at a very early stage. Another thing that increases the risk of having cervical cancer is the use of contraceptive, the use of drugs that induces abortion. Another thing is smoking, and for people that have reduced immunity. So how can you prevent this cancer? How can you, another thing in which you can use to prevent this cancer, aside taking vaccine, you practice a safe sex, you go for your regular screening, you get vaccinated. Thank you very much. I hope you've been able to learn one or two things about cervical cancer, and don't forget that prevention, this cancer can be prevented and can be treated successfully if diagnosed at early stage. Thank you very much.